everyone. Thank you so much for being back. This is a Love is Healing podcast, and I am your host, Magnolia Heaton. And today we have a guest. This is Dr. Wincy. He goes by
Hello.
Troy. Hi.
Yeah.
To
Hi.
Dr. Lee. Yes.
Yes.
So thank you so much for joining us here today.
Of course.
We're gonna be talking a bit about Chinese medicine and chiropractic and a bunch of fun stuff today.
Great.
Yes. So tell us a little bit about where you came from.
Okay. Well, so I was born and raised in China. I'm from Yizhen, Jiangsu province, China. It's a small town, even though we have about 500,000 people in that town. It's a small city.
Wow.
Right.
Uh-huh.
Yeah. And I moved to the US when I was 19. I went for college. I went to Ohio State University. I graduated from there and went on for chiropractic college. And now I'm here.
Awesome. Thank you. Okay. How is Chinese medicine different from American medicine?
I think it's a very interesting questions. Even though I don't practice traditional Chinese medicine, but I do have a few understanding of it, being Chinese. Right? So traditional Chinese medicine is an observation of health and disease through thousands of years, right? The knowledge is accumulated and transformed into a system understanding of what, how, and why. Right? This is why the terms and logics in traditional Chinese medicine are generally very vague and arbitrary to laymen, right? We talk about qi, we talk about flow of energy, we talk about blockage, the meridians. These are just like we self-define them. But that this is also the reason why this philosophy of healing is applicable through time, no matter how diseases change and how we understand it differently in modern time. And this is very similar to chiropractic. We have our own term. It's a system of healing arts that is tested through time and it's applicable regardless of name disease in Western medicine, right? Traditional Chinese medicine, we talk about qi, flow of energy that governs the function of body. Disease arises from blockage of flow of qi, and health arises from removing the blockage of qi and restore flow of energy. In chiropractic care, we talk about nervous system that controls every function in the body, right? Disease arises from interference with flow of nerve, right? The health will arise from correction of that neurological interferences that impedes on the transmission of nerve impulses, which we call vertebral stabilization. When it comes to American medicine, if we're discussing in terms of modern medicine, Western medicine, or allopathic medicine, I would say it's also an observation, right? I would argue all branches of health is observation. But instead of putting things into a system of understanding, or I prefer using the term of philosophy, right? The Western medicine observation of these evidence is rendered through clinical trial, scientific studies and researches, right? Through the progression of the science and different discovery, our understanding changes all the time, right? And I have to state this foremost, right? We need modern medicine, and modern medicine has saved millions and billions of lives, right? Because of the progression of our science, right? Infections, cancers, genetic sequencing, bioengineered medications, right? Surgeries. We save so many people with modern medicine. I just had a patient with trisomy 18. It's a genetic defect of chromosome 18, right? The survival rate is really low. And this little precious baby um, was in NICU for 105 days. And she had open heart surgeries. She had different medications. Like the modern medicine kept her alive, right? This is already a miracle. And most of the survival rate, I would say, is about like a couple months to a couple years. So that's how important the modern medicine is, right? But here's the problem. Our generation is getting sicker and sicker, sicker than ever. Magnolia, what time were you born? Are you born in the 90s?
Me?
Yeah.
No, I was born in the 80s.
Oh, you are?
Yeah.
Oh, okay. Because I'm born in the 90s. So I want to use the time frame to show you some data, so like how our health has changed through generations, right? So since 1990s, the obesity rate doubled in the U.S. adult and quadrupled in adolescents. About 42% of U.S. adults have obesity today. The cardiovascular disease death rose about 70% since 1990s. Cancer cases has more than doubled, increased about 105%. Right? We have more surgeries. Lumbar and cervical fusion surgeries increased about 200%. We have more prescription of medications. Amount of antibiotics prescribed increased about 65%. Amount of opioids prescribed increased about 800%. The number of Americans using muscle relaxants increased over 1,400%. The autism rate, autism prevalence is about 1 in 1,000 children in 1990. Today, we have 1 in 31 children has autism. 1 in 10 to 12 female has infertility in 1990s. Today, it's 1 in 6 to 8. 1 in 14 to 20 men has infertility in 1990s. Today, it's 1 in 8 to 14. Right? So all this data is just showing we're not getting healthier, regardless how advanced our medicine today is. Right? This is the biggest problem today is the modern medicine is advancing, yet our generation becomes sicker. I think this is exactly why we need natural healthcare that does not look into sickness and diseases, but how to maintain health and promote well-being so we don't get sick. I think prevention is way more important than treating cases that's becoming more complex. And I'll explain why later, why things are getting worse in terms of health. Right? I think chiropractic will play a crucial role in healthcare today.
Definitely. Thank you for that. Yeah, in social work or mental health, we have different levels of intervention.
Yeah,
And so prevention is the first tier, right? Because it
that's right.
takes less effort if you prevent it. Like it's like, okay, cool. You just
Exactly.
kind of monitor, make sure things are good, right? But
Right.
then when you get to the point where you have really big diagnoses or a lot of problems or legal problems or different things like that, then it's like, yeah,
Right.
it takes more effort to address it at that point. So yeah, absolutely. Definitely.
Yeah.
Thank you. Thank you. I mean, essentially, it's like Chinese medicine and
Mhm.
chiropractic are prevention, or like it's kind of more philosophical, is how I look at it. Is that what it is? It's
Yeah,
philosophical.
because we have a system of understanding how things work, and no matter
Yeah.
how disease change, uh, in the name disease, we apply it the same way because the goal is not to treat, right? The goal is not to treat a disease. The goal is to promote health,
Okay.
right? It will be the same across disciplines. It will be the same across in terms of disciplines, meaning okay, you have infection, immune system problem, okay, you have pain, you have digestive problems. We can all help. We help them the same way.
Yeah, and it looks at the body as a system, right?
Yes, we look at the body as a system, not parts. Right. This is
Yeah,
major differences.
that's true.
Yeah.
Okay. Thank you. And then, why did you become a chiropractor?
Well, this is a very good question too. So I never believed in chiropractic when I was younger. Right. I don't believe anything outside of Western medicine.
Oh, wow.
Yeah, you can call me scientism, actually, right? This is actually a false belief. It's just a false pride in terms of how I understand the world, how it works. But I was looking for a solution for my pain. I had a hiking injury in Cuba while I was in college. It was a really fun trip, but I came back with low back pain, and it turns into neck pain, upper back pain, hip problems, knee pain. I couldn't walk for about
Oh,
6 months. Yeah, and I was devastated. So I was looking for help. I went to PT, I went to MD, I went to DO, which is Doctor Osteopath, and I saw so many practitioners, and they all helped me very little bit. I did get better. I can walk again, but I was in pain every day. and I suffered pain for over 2 years, and I was devastated. And then you know what? I'm just gonna give chiropractic a try because I honestly don't know who to see again. And it's such a miracle experience for me. Just with the first visit, the first adjustment I've had, I was about 70% better that
Wow.
night. So
Dang.
it really shocked me and then changed how I understand chiropractic actually work.
Hmm.
Right. So then I started looking more into chiropractic care, and I discovered chiropractic, and now I'm here.
Very cool. Thank you for that story. You
Work.
know, I have a lot of, yeah, a lot of the chiropractors that I meet at seminars, I think, a lot of the men in particular, that's how they found
Yeah.
chiropractic.
Yeah.
It's either like their parents did chiropractic or they got hurt.
Yeah. Yeah. I think it's a common trend. Yeah.
Yeah,
How
yeah,
we get
yeah.
into this profession.
Yeah. Awesome. Okay. And what is a chiropractor?
Great. This is another good question. I actually prepared the slideshows,
Perfect.
and let's go over that.
So if y'all are watching on YouTube, you can totally see the beautiful
Yeah.
slideshow that we have.
Okay. So what is chiropractic? So chiropractic is a philosophy, science, and art of things natural, a system of adjusting the segments of the spinal column by hand only for the correction of cause of dis hyphen ease. Right? We can talk about it. Things natural, right? That means we don't use medications, right? We don't use that things that's synthetic, right? We use things that are natural ways to let the body heal, right? The reason why we adjust the spinal column because the spine houses our nervous system. Our brain is protected by the skull, the spinal cord, and the spinal nerve are protected in the spinal column. And our nervous system controls every other function in the body. If there's any misalignment and impingement of nerve that interfere the transmission of that neurological impulses into the rest of the body, there's going to be dysfunction, right? Under well-being. We want to stay away using the term disease, right? That's why in chiropractic we talk about dis hyphen ease, which is you're not well, right? Because we want to stay away from treating. We want to promote health, right? This is the differences. Okay, so that's chiropractic. And science and art philosophy, what it is, how it is done, and why, right? We use science, right? We see how things are changed, right? We use X-rays. We look at research. We want to understand how what it is, and art is the way we do things, right? It is how it is done through our hand, through our specific adjustment to correct vertebral stabilization and remove the correct the neurological interferences. Philosophy, obviously, is the why we do things, why we're doing this. And I want to talk about the philosophy a little bit more, how we think differently as a chiropractor. Chiropractic uses deductive reasoning, and there's a difference between the logic and the reasoning, one being the deductive reasoning, another being inductive reasoning. So deduction is go from general to specific, right? We start from a general statement or premises and narrow down to specific logical conclusions versus the induction, we're going from specific into general, right? We move from specific observation, just like Western medicine, to a broader generalization of how things work. And this is the difference between chiropractic care and the rest of healthcare, that we think from top down, inside out, right? The deduction is built upon premises, right? It's a fact, truth, and rules that will never change no matter what we observe in small details, right? Induction is really built upon conclusions from observation of, different behavior, different patterns, how does medicine work for this patient, how does medicine work for that patient, and we use statistical data to reach a conclusion. And yeah, the deduction is based on truth, fact, or axiom. Axiom means it's a statement or fact that will never change. It's true by itself, right? The induction is based on probability when it comes to statistical data, right? So, and it will change all the time, right? The statistics will change. And it may not be the fact because our understanding will change all the time based on different data presented, right? Here's an example of deduction. Okay, so we have an oven. There's a fire in the oven. There's all smoke are coming out. It triggers the smoke alarm. So what do we do about it? All right, we see the smoke. That's a symptom. That's a sign we observed. Are we going to call the firefighters to put it out? Because there's a fire, obviously. Because the smoke is the symptoms. So we call the firefighters. We'll break the smoke alarm. Right? We don't hear the beep anymore. Does that solve the problem?
No,
No, yeah. Why is that?
because the
Because,
fire's still there, right?
yes, because it's the oven that's the problem. We didn't put out a fire in the oven. We just solved the symptom, the sign we observed. Right? That's the smoke and the sound of the alarm. And here's another example. We have this poor dog. Poor dog's tail was caught in the under the couch. Right? You hear all the barkings. It's so loud. We hear the barkings. That's a sign of a problem. So what do we do about it? Okay, how do we stop barking? Let's give the dog an anesthesia. So we stop the barking. That will solve the problem, right?
Yes and no.
Yes and no, right? That's a band-aid, right? We did stop the barking, but what's the problem? It's the tail. So what should we really do?
Take the couch off of the dog.
Yes, you're exactly right. Here's an example of induction, right? Like I said, induction is from observation to conclusion. So what do we see in this picture? So we have two soldiers, and then we see a rifle that's pointing to one of the soldiers. So what's your conclusion when you see this picture?
He's either about to get hurt or they're messing around and it's not a good idea and he could get hurt.
That's pretty bad. Someone is about getting hurt. Okay, let's look at another picture. What do you see here?
I see a soldier giving another soldier a canteen of water.
Yeah. Okay, so it seems like the soldiers are being saved. But this is our observation through parts of the pictures. So what's the biggest pictures? What's the bigger pictures we see?
Both
Right?
things are happening at the same time.
Exactly. That's why if we observe a specific point or parts of the problem, parts of the picture, our understanding will change all the time. This is a problem of induction. Inductive reasoning from observation to conclusion through a specific point to draw conclusion to a general picture. This is the fallacy of induction. Okay, I have a research that shows infants does not feel pain. Right, surgeries can be performed with minimal or no anesthesia, and that's published in 2013. Right, back in the days, instead of babies were administered muscle relaxants, were administered muscle relaxants to stop them from moving during invasive procedures instead of giving them anesthesia. And this is actually because this was compounded by the fact that studies in the 1940s incorrectly draw the conclusions because babies don't respond to pinpricks and they think, okay, the babies doesn't feel pain. This is the failure to correct interpret that infant body languages, right? Baby still feel pain. And our understanding changed based on the fact that the evidence we observed. And it is officially banned in 1987 that infant or baby surgery without anesthesia is illegal. How crazy is that? right? I have different slides that shows historical literature on infant pain and how we change our understanding based on observation, on how we change based on observation and change our conclusion of how things work. Okay, so that's why in terms of chiropractic, we don't use induction. Instead, we use deductive reasoning to start with a general premises that how the universal law works, and then we draw a conclusion. We work top down, inside out, to how we're going to change the perspective of our health. This is why I stated earlier, things can be a little different in terms of terminologies that we talk about in chiropractic care, same as the traditional Chinese medicine, right? But it will be tested through time because it doesn't change. Our understanding will be always the same, right? It'll be great that we have more data, more scientific research that give us insights. But so far, it's been over 150 years, and none of our philosophy will change. And we still help the people the same way we do, and people still get better. Just like traditional Chinese medicine, it's been 5,000 years, and it still works.
Is this because you're treating the root cause or just supporting the body and healing itself?
That's a yes and no. Yes, we're looking into the root cause, right? We're addressing the root cause, but we don't treat. We support it. We support the body's ability to heal. Yes, this is the differences.
That's
We're
right.
trying to look for the root cause.
Perfect. Thank you.
Yeah.
Are all chiropractors the same?
That's also an yes and no, right? Chiropractors are all trained through intensive schoolings from the Professional Chiropractic College. We all take board exams. We earn our degrees and our license, and we have the same right to practice, or generally the same across different states. But the reason why I say it's no is because chiropractic is really an art. It's a different expression how we support the function of the nervous system, how we correct a neurological interference, how we address neurological problems and vertebral stabilizations, right? That's why chiropractic we have different techniques. There are chiropractors doing full spine, which is most of the chiropractors. There are chiropractors using instruments to adjust. There are chiropractors that only adjust the top bone of the body, which is your atlas, the first cervical spine, and then we all achieve the same thing, right? I lost my train of thoughts, so probably.
Just differences between different chiropractors.
um, yeah, I think that's the differences.
Okay, perfect. And
Perfect.
then I've also heard that there's animal chiropractors. I think, did you say you were an animal chiropractor too?
Yeah, I'm certified in animal chiropractic
Yeah.
through the International Veterinary Chiropractic Association, and I love to work on animals too. You know, dogs, cats, and
Yeah.
horses.
That's right.
Um, I would say it's the same, right? Chiropractic care for animals is the same for how we care for humans. We make specific adjustment to address vertebral stabilization in animals to restore transmission of neurological impulses that allow the animal body to heal itself. Yeah.
Okay, cool. Thank you. Does what is an adjustment? I think you kind of covered it, but what is an adjustment and then does everybody need one? Why?
Yeah. Adjustment is the correction of vertebral stabilization, right? And I'll argue that everyone will be stabilizated in some points of life. I have slides that showing that. In chiropractic, we talk about three keys, right? Trauma, toxins, and thoughts. Trauma is your physical trauma in the body we experience in the life, right? You can fall, you can get injured, right? You play sports, there's a sports contact. Those are physical impact, right? These daily behaviors can contribute to micro trauma in the spine and nervous system, right? Just like our cars, right? We need to replace our brakes probably like 20,000 miles because things are going to break down by daily uses and over time. right? So trauma is everywhere in the body, everywhere in the environment too. And speaking of birth, the process of birth itself is a trauma, right? If you don't know about the birth process, it's very traumatic for the babies and for the mom too. Do you think the baby and the mom will need adjustment? Yes, I would totally agree. The babies and the mom need adjustment. Toxins. So it's the exposure that we have from our environment, our food, chemicals, heavy metals. Different exposures of these toxins are really disrupting the balance of our health. And our nervous system will know, right, when our organs are suffered. Right? This is called visceral somatic reflexes, right, from organ to somatic body. Right? Our nervous system will get irritated because of the exposure we have in life, and we'll get stabilized that way. Right? Stabilization pretty much means it's imbalance and of the nervous system. Same for thoughts. I think that's even more powerful, right? The stress, the anxiety, depression, traumatic experiences, PTSD, those are all negative impact our health and our nervous system. Magnolia, you practice a special technique called a neuro emotional technique. Can you explain that
I
a little bit
can.
to me? Yeah,
Yeah. Thank you. So like I like this slide a lot. I think it talks a lot about the mind body connection, right?
that's right.
I'll go over this real quick and then I'll get into the NET piece of
Hmm.
these. So what comes to mind is like, yeah, there's trauma. There's physical trauma that can happen to the body and then that has different impacts. The way that I look at it is like things are bidirectional. So then
Yeah,
if say a physical trauma happens and something happens to the body, okay, maybe it causes chronic pain. But then if I have chronic pain, then I'm going to have all kinds of feelings about it. And then if I have feelings about it, I'm also going to have thoughts about it. The thoughts are going to feed my emotions. And then the emotions can also cause further tension in my body and different
I
things like
completely
that.
agree.
Right?
Yeah, yeah. I can give you a scientific example as well, right? Let's say we're lacking exposure to sunlight. We don't make vitamin D in our body, and if we have low vitamin D, we're gonna be depressed. And also, vitamin D is very important to turn calcium from tissue into ionized calcium in the blood. And our muscles need ionized calcium to make contractions. Otherwise, the muscle will go into spasm. That's why the sign of low vitamin D will be restless leg syndromes or muscle spasm. Guess what? That's going to create trauma, right? So things are going to interconnect with each other, right?
Yeah,
We're always the body will always work as a whole, right? So we want to address the body as a whole instead of parts.
definitely.
Yeah,
And then I know you're going to talk about it, or something that I hear you talk about sometimes is that the body has its own innate intelligence. And I agree, right? I
yeah,
think we are really intuitive. The vagus nerve picks up on a lot of things. The heart picks up on a lot of vibrations, a lot of different frequencies, right?
hmm,
And then it kind of talks to us. But yeah, all these things are interfering with the signals, right? And then the body's like, hey, something's off.
hmm.
And then with the toxins, I look at the body as a car, to use your
Yeah.
analogy, right? It's
I
like
like that analogy.
you need
Yes.
to have enough oil. It needs to be clean oil. You need to be having the right gas. If you're using gas and it's a diesel car, I mean that's not going to run. Or the opposite is also true. So we need
Right.
to make sure that we're feeding it the right thing. So we need to make sure that we're having enough of the positive things that we need, right? And then of the negative things or the toxins that we have, we need to be able to detox well. So we want to look at our organs and make sure that they're outputting whatever it needs to output and filter what it needs to filter, but
Hmm.
also just kind of cleaning the body, cleaning the blood, and different things like that. Different things that I've seen are for the toxins, like there are different modalities. There's plenty, right? I think in chiropractics, but
Yeah. Even in chiropractic care, there are chiropractors specifically looking into toxins,
yeah,
such as the kinesiology techniques, including Lebowitz protocol,
yeah,
which is it's a specific testing for the functional sensitivities to different exposure of food toxins, heavy metal problems, different microbes, bacteria, parasite, yeast, and it does shows great result.
yeah,
Right.
definitely.
That's
So
all kind of in the umbrella of chiropractic, but really the true chiropractic is the correction of neurological problems through the vertebral column. through the correction of vertebral subluxations,
Yeah.
right? You can so I always talk about the um, the core of chiropractic care. The reason for that, when we address toxin itself, like Lebowitz protocol, or we address the emotional problems using your emotional technique, they're not really chiropractic, but they support the chiropractic.
Yeah.
Yeah, they if we have less exposure to toxin and thoughts, we're gonna be less chances to get subluxated, but people still will be subluxated regardlessly of what of the situation, right? So I would say the goal of a chiropractic is to correct that neurological interferences through the body, by correction of the vertebral subluxation, and the other supporting technique like Lebowitz to address toxins, neuro-emotional technique to address emotional problems will greatly reduce the chances of vertebral subluxation.
I agree.
Yeah.
And then with the with the thoughts portion of
Mhm.
things too. So like being in therapy, being a therapist, whenever I talk to clients, whenever they start talking about things that are really emotional, I can start to see different things. The body's always talking. So like I see things like the jaw starts to really clench up or the
Yeah.
shoulders start to come up, right? And if we're constantly stressed, I mean, our shoulders come up and then our body curves over time, right? Or we're holding our fists because we're
Yeah.
always really mad, different things like that. So yeah, that can cause a lot of different shifts in the muscles and things like that, and that can lead to subluxation too. I think that right subluxation just this is how I conceptualize it. It helps to release a lot of different things, right?
Mhm.
And I think that's the power in chiropractic. And then also with NET, one thing that they say is that the issues are in the tissues. The reason that I'm saying like chiropractic techniques, so forgive me if that's incorrect. A lot of chiropractors are the ones that created these techniques because they understand the whole picture, which I love,
Right.
right?
Right.
And it's just right a component of like this whole these three T's of chiropractic. But with the NET, what happens is like you can address it different ways. You can work on the adjustments, right? There's different spots along the spine that relate to different organs in the body, and then that helps to like release energy from that, and then that helps the body function better. But really it's based off of like the different emotions or the different thoughts that people have,
Yeah.
and then you use that as a body entry or use that as a mind entry, and then you help to like release those issues that are living in the tissues, those problems that are living in the body, that trauma that's stored in the body.
Exactly, and that's all coming from the brain and the nervous system. Our brain responds to everything we expose to, right? The emotional stress will trigger the stress in the hippocampus and cerebellum. Right? There's a new research that's showing the neuropeptide created by the brain during emotional or emotional stressful situation will interfere with the cerebellum, which controls the coordinations, controls the balance, the proprioceptions, how your muscle move, how your body moves, and guess what? That might creating trauma, right? Just like we talked about earlier, things are interconnected. The different components can influence others, right? That's why we see in clinical situations, right, when people are under emotional stress, just like you said, we see jaw clenches, we see the muscle tightening, we see the shaking, we see changes postures, right? This is all interconnected. Just we know that. We already know it. The science is there to prove it that we're right from the beginning, right? So that's why this is different. We have this generalized understanding of the truth of the fact, but it just need more data from science to prove it.
Yeah, not everything that's true can be like, I mean,
Yeah,
there's some
it's
things that you
hard.
just know
Yeah,
and you just know that it,
we
you know what
just
I mean?
know it's there, but it's hard to prove, right? Doesn't mean it's
Yeah,
not true. We just
right.
need more study. We just need more time to figure this out.
Exactly.
Yeah, of
Awesome. Thank you for that. A good discussion there.
course.
What is, sorry, I have my list of questions here.
Hmm.
Let's see. My chiropractor says that adjustments can help treat arthritis. Is that true? And if so, how?
We can definitely help. But the problem is we did not treat, right? Chiropractors, we address one thing and one thing only, which is vertebral subluxation. Subluxation is a condition of a vertebra that has lost its proper juxtaposition with the one above or the one below. and I actually have the slides that's showing that, or both, to the extent less than a luxation which impinges nerve and interferes with the transmission of mental impulses. Right. This is chiropractic definition of vertebral subluxation. I explain that. Right. So the proper juxtaposition, like we mentioned, is how your spine normally supposed to be. Right. Your spine houses in your spinal cord and spinal nerve. If there's a misalignment, just a tiny misalignment that's less than a luxation, luxation means separation of the joints, right? Just 1 millimeter or 2 millimeters of differences, now creating neurological interference, right? And we talk about MOPIs, right? Misalignment, occlusion of the foramen, which is the hole or space where the spinal nerve are traveling from the spinal cord to the rest of the body, to your muscles and to your organs. MOPI, impingement, right? Impingement of nerve, and that cause interferences. We the research already showing that just 1 or 2 millimeters of changes within the spinal column will creating major neurological problems. Right? The research are showing the width of a lumbar spine. Let's use lumbar spine as examples. The width of lumbar spine, which is the whole of the neuroforamen, is about 8 millimeters, but it's not really a tube. The neuroforamen is narrowed in the middle, right? So narrowest part of the neuroforamen is about 4 millimeters in lumbar spine. That's a major differences. So imagine 4 millimeters of space, and then we have nerve that traveling out of there. Would you think 1 millimeters of a change will make a big difference?
Yeah.
Yeah, that's 25% of spaces that's lost, 1 in 4. So all these neurological interferences is going to influence everywhere else in the body, right? Because our nervous system regulates all the function, autonomic functions, parasympathetic nervous system, sympathetic nervous system, and that the goal of chiropractic is for that 1 millimeters of differences. We want to take the pressure off the nerve and to allow the nerve to flow without interference, so the body can have the ability to heal itself, right? That's why when it comes to arthritis, yes, we can help, but it's not really a treatment. That's not what we're doing here. The goal is to correct neurological problems and address vertebral subluxation so we can let the body heal itself. We can slow down the process of arthritis, or in some people say they're cured. But that's not what really we're looking for. We just want to let the body to function how it's supposed to be without neurological interferences.
Like, okay. So chiropractic is helping to heal a lot of the foundations of the body that supports itself to heal. So that's why we're able to see improvements in functioning in individuals that have autism and ADHD as well, because we're supporting the nervous system, we're supporting the neurology.
Yes, 100%. Right? That's a lot of people that ask chiropractors. Okay, do you treat cancer? Do you treat digestive problems? Do you treat mental issue? Do you treat ADHD? Do you treat autism? No, we do not. We do not treat the named disease in Western medicine. But can we help? Absolutely. Everybody have a nervous system. It's a simple fact. When things get compressed, when nerve get compressed, there's going to be neurological interferences how you function. The goal of chiropractic is to bring the body to its normal state, flow of neurological impulses without interference. Right? Regardlessly is cancer patient or children have autism, we can help. We can normalize the system regardless of the foundation. Right? We talk about limitation of matters in chiropractic care. The body is very limited, right? You can have genetic changes that causing some issues. MTHFR, which is methylation of folate, right? When you there are people who couldn't methylate folate, so they have immune problems. They're going to have detox issues. But can chiropractic help with that? Yes. We are going to address the nervous system, make sure it flows as it's supposed to be, so we have the best chances to heal, regardless of the problem is. But obviously, I'm not saying that the people who have cancer or autism shouldn't seek care from other practitioners or shouldn't seek care from cancer from the Western medicine. Obviously, they do, but chiropractic is still be able to help them. Right? I don't want to take away the benefit for everyone who will experience stabilization in their life.
Definitely. And I know with autism and ADHD, there tends to be really tight fascia anyway. So there tends to be a lot of challenges with like
Yes, definitely a lot of
joints.
challenges.
Yeah,
Right? That goes back to our three T's:
exactly.
trauma, toxin, and thoughts.
Exactly. Yeah. Thank
Yeah.
you. Awesome. What are some things that chiropractics can treat that allopathic medicine? Oh, well, we're not using treat. Sorry, this is the way that I wrote the
Yeah.
questions. That chiropractics can address that allopathic medicine cannot address.
Well, I would say we are be able to address almost nothing and anything, right? Because we're not looking into disease. Because when you put into terms into disease, you can have all sorts of problem. We're only looking into how the nervous system function, right? We want to regulate the nervous system so we don't get sick. We can maintain health. So that's why our patients are calling us miracle doctors all the time because we can help the things that nobody thought we could. Because we're not looking into sickness. We're only looking into how to bring you back to health. I have patients coming to me all the time with different problems, whether it's digestive issues, whether it's shoulder pain, whether it's knee pain, low back pain, neck pain. We can help. But the truth is, I'm not really treating. All I'm doing is correcting vertebral stabilization to allow the body to heal itself. Right? In chiropractic, we talk about innate intelligence. Does the body truly heal itself? Yes. Right? Innate intelligence is it's a more intelligent that in the body to governs the function of the body, just like homeostasis. Right? The body knows the best how our body should function. Right? Let's, for example, the blood pressures. The blood pressures will fluctuate all the time based on different condition. Right? If you're running, your blood pressure will rise to supply you enough oxygen, supply your muscles enough blood to meet the requirement how it's supposed to be. Right? With the resting, your blood pressure will drop to allow the body to rest, right? Because you don't need not much of a blood supply or oxygen supplies, right? This is how our body regulates itself. This is innate intelligence, where in terms of Western medicine, we can call this homeostasis, right? The body will change based on different condition. And this is always supporting by addressing the vertebral stabilization is to allow the body to be in that homeostasis state so we can stay healthy. Right? We want to give the body best ability to stay healthy.
Thank you.
Yeah.
And I think our final question is, what are some final suggestions that you would have for our audience?
Well, I would really encourage our audience to look into natural healthcare. Instead of thinking about, okay, I'm getting sick, I have this disease, I have this problem, let's look into how to maintain health because this is very simple, right? Three T's: thoughts, trauma, toxins. We are what we eat, right? We need exercise, we need physical maintenance we need care for our nervous system, right? If you're doing all that, right, by taking care of yourself, by going to the chiropractor and address the neurological problems, and we're going to prevent disease, right? We're going to get people healthier because that's the problem nowadays. It's just our environment are getting more toxic than ever, right? Especially if you go to the packaged food and reads the label and you have this 20 different ingredients and I couldn't even tell you what they are, right? So we're getting so much exposure in life, right? the internet, the TikTok, the Instagrams. Right? Our kids are scrolling phones all day long. They're getting different exposure to things that's never been before, right? And also the COVID, isolation, right? Immune problems, the isolation from each other, giving us mental issues. There's a lot of thoughts, trauma, and toxins in today's world, and we definitely need chiropractic care to address these problems and correcting the neurological interferences, correcting vertebral subluxation, are going to help our generation so much. So let's look into natural healthcare and how to get healthier instead of treating sickness. Let's promote well-being through natural healthcare.
Thank you for that. And again, this isn't medical advice, but we're just encouraging you to look into it so that you can draw your own conclusions as well. Thank you. So if you would like to work with Dr. Lee, he's currently in Akron, Ohio, for a couple more months, and then he will be practicing in Scottsdale, Arizona, starting this fall at ACE, that's ACE, ACE Chiropractic. Dr. Lee, thank you so much for being
Yes.
with us today.
Thank
Appreciate
you so
it.
much, Magnolia.
Absolutely. You're welcome. And then their website is www.scottsdaleazchiro.com, and their Instagram handle is ace_chiropractic. They currently have 2 locations in Scottsdale and 1 in Phoenix, and they're about to open a 3rd location this fall. Thank you
That's
for
right.
joining us.
Okay, thank you.
See you next time.